I'm Dr. Lucas Schreiber. I'm the owner of a small multi-specialty clinic in Taos, New Mexico. I work at Holy Cross Hospital, and I'm the medical director for Mountain Home Health's hospice program. In my various roles as a physician in northern New Mexico, I've seen firsthand the ravages of COVID-19. I don't intend to reflect on the reasons why the United States, the wealthiest nation on earth, home to just 4% of the globe's population, is responsible for 21% of all COVID-19 cases and 18% of all COVID-19 deaths. I think it makes more sense at this point to look forward. And when I think about the future, what keeps me awake at night are the results of several recent daunting surveys that found that fewer than 50% of Americans currently say they will get the COVID-19 vaccine once it's available. And I get it. We're living in a time of rampant misinformation and deep distrust for those who don't share our beliefs. And this vaccine was produced in record time. But as it turns out, it wasn't rushed through for political expediency, as many of us in the medical community had feared. And the mRNA technology that's being used is not brand new. We've actually used it for cancer treatment for years. But most importantly, we're not asking you to get the vaccine just for your own sake. It's true, you may be one of the lucky, young, healthy people who's just an asymptomatic carrier. It's possible that you will only experience mild cold-like symptoms. But the vaccine could prevent you from feeling horrible for weeks with muscle aches, fevers, shortness of breath, and cough. It could prevent you from being hospitalized or placed on a ventilator. It could, in fact, save your life. But again, it's important to understand we're not asking you to get the vaccine just for yourself. You're getting it for your grandmother who lives in a nursing home. You're getting it for the person down the road whose immune system is feeble from the effects of chemotherapy used to treat their breast cancer. Girls, come here. You're getting it for Lucy, so she doesn't become one of those people, one of those children who gets multi-system inflammatory syndrome and has her kidneys shut down. You're getting it for Annalie, who has a T-cell immunodeficiency and can't adequately fight viral infections. You're getting it for Sari, who's so cute you would do anything for Sari. You're getting it for my best friend Ben, who has common variable immunodeficiency, and his body doesn't make antibodies to fight bacteria and viral infections. You see, it's the most vulnerable amongst us that rely on us and the decisions we make to keep them safe. So you're getting it for the health of humanity. So let me ask you, what type of global citizen do you want to be? Are you the type of person who would sit safely across the street on the curb watching your neighbor's house burn as their children cry for help? Or would you be willing to take a risk to save somebody else's life? If this resonates with you, or you know somebody who might be moved by my appeal, please share this. But most importantly, please get your COVID-19 vaccine when you have the chance.